Great. Good afternoon, everyone. I'm going to call this meeting to order at 3:32. And the very first thing that we want to do, of course, is to have our language justice folks, our language justices, so that we have the languages so everyone can participate that wants to. Which one of you, Diego, are going to do our language justice?
I'll be doing it today.
Okay, Diego, take it away.
Sounds good. Thank you, Sherry. Good afternoon, everyone. My name is Diego Pons, here today on behalf of the Community Language Cooperative with my colleague, Gisela Escobedo. Thanks as always for having us at your meeting. Today, we're going to continue practicing language justice. So all this means is that we're here to help create a space for people to participate and engage in the language of their heart, just simply the language that you feel most comfortable in. We'll continue using simultaneous interpretation to help create the space in English and in Spanish. So once I'm finished saying this in English, I'll repeat the instructions in Spanish. At that moment, turn on the interpretation. Once the interpretation is turned on, you'll be able to see a globe icon that says interpretation there in the bottom right-hand corner of your computer screen. Please make sure you select that globe icon and please make sure that you select your preferred language. If you happen to be joining today's meeting on your cell phone or your tablet, however, I'll ask you to please look for the More button or the 3 dots button in order to select your preferred language that way. So if you're not fully bilingual, we'll always encourage you to please select your preferred language so you may utilize the interpretation in case anyone were to speak in the opposite language. But if you are bilingual, you can just feel free to listen to everyone in the original language. You would not have to select any language channel and you would not ever have to hear our voices. As always, when you select your language, you can check mute original audio so you don't have to be hearing both languages at the same time. And as always, we have a special ask right for the English speaking audience. Just please pay attention to the speed in which you're speaking, since Spanish is about 20% longer than English. Just please make sure that you're speaking at a conversational pace and please make sure that you don't pick up your reading speed. So thank you for that. Buenas tardes a todos y a todas. Mi nombre es Diego Pons. Estoy aquí hoy de parte de la Cooperativa Comunitaria de la Justicia del Lenguaje con mi colega Gisela Escobedo. Como siempre, gracias por invitarnos hoy a su reunión. Hoy nos vamos a comprometernos otra vez a servir la justicia del lenguaje. Lo que eso significa es que queremos crear un espacio para que todas las personas puedan participar e involucrarse en el idioma de su corazón, que es simplemente el idioma que todas las personas se sientan más cómodas. Y hoy vamos a continuar utilizando la interpretación simultánea para poder crear ese espacio aquí en Zoom, en inglés y en español. Cuando yo termine de decir esto, se activará la interpretación. Ya cuando la interpretación está activada, usted va a poder observar un icono de un globo terráqueo que dirá interpretación ahí abajo en la derecha de su pantalla. Por favor, seleccione ese icono del globo terráqueo y por favor, seleccione su idioma preferido. Pero si usted está asistiendo a esa reunión en su celular o en su tableta, yo le voy a pedir que por favor seleccione la opción que dice More o posiblemente el botón de 3 puntos para que usted pueda seleccionar su idioma preferido de esa manera. Si usted no es completamente bilingüe, le voy a pedir que por favor seleccione su idioma preferido para que usted pueda utilizar la interpretación cuando alguien está hablando en el otro idioma. Pero si usted sí es bilingüe, se puede sentir libre hoy de escuchar a todos en su idioma original. No tendrían que seleccionar ningún canal de idioma si no desean hacerlo y no tienen que escuchar nuestras voces jamás. Como siempre, cuando usted seleccione su idioma, puede hacer clic en silenciar el audio original para no escuchar ambos idiomas al mismo tiempo. Muchas gracias.
Thank you, Diego. Let's jump right into it. We are going to have some updates. Christine Billings, would you like to give us some updates?
Hi, Sherry, certainly, thank you. So a quick COVID-19 update for the Board of Health. Thankfully, it's quick because our data has stabilized, if not decreasing in numbers, which is not unexpected from the modeling that we have seen at the state level. So statewide cases and percent positivity are slowly trending down in Colorado. The average number of cases per 7 days is declining, so it's on a downward trend. We did have a low of 303 for that moving average in March, climbed up about the second week of June, it peaked, and we've been declining ever since then. Hospitalizations are following that trend. They are also slowly declining. And an important note is that the BA.5 variant of the Omicron strain of COVID-19 has substantially overtaken all of the other variants that we have across Region 8, which is the region that Colorado is in, as well as across the nation. That's the variant that has caused the most recent wave of COVID-19 that we are exiting at the moment. CDPHE has added a new variant to their dashboard. We do not have a bunch of information on this. It's not making a substantial amount of the cases, but there were enough samples that tested positive for this BA4.6 that they added it to the variants of concern that CDPHE is tracking. This is a visual representation of that decline in case counts. The blue color, so the color of these end bars down here, represent a sustained decline in those case counts. So you can see our peak happened right about the second week of June, and we've been declining ever since. Similarly, this is a visual representation of that decline in hospitalizations. We're down to 243 as of August 9th. I expect that our update tomorrow will show an even lower number of hospitalizations due to COVID-19. This is consistent across the nation as well. Another visual representation of where Jefferson County sits within the state of Colorado. We are this longer yellow county right in the middle. As you can see, we are similar to the other Denver Metro partners, and we are tracking in the right direction. I expect the modeling that I've seen shows that our case counts will continue to decline through September, leading into the month of October, even with the return to the school and the return to indoor activities. So looking at Jefferson County data, our hospitalization rate has been fairly stable at that 0.7 per 100,000 rate. Our case count is really close to dropping below 100 per 100,000. Very, very good news. Our test positivity continues to decline. Again, the visual representation, this is the COVID-19 trend over timeline. You can see this is the wave that was caused by the BA5 variant of Omicron. We are trending down. Again, it's expected that we will continue to decline through the month of September. After that, the modeling was not able to predict that far out as to what we should expect in terms of trending. Hospitalization data, as you can see, as I mentioned, we've been bouncing around that 0.7 per 100,000 mark. I would expect as we move into lower case counts that this hospitalization number will continue to decline. Hospitalization is that indication of the severe manifestation of COVID-19 disease. Therefore, if we see this number continue to decline, we know that we are in a really good position with the fight against COVID. So visual, we are continuing. We are in the third week with our case rate below 150 per 100,000. As the data shows, we are right above the 100 mark. We will continue to update our data dashboard, and so you can always find that information on these slides. Visually, this is another representation of that graph that was in the statewide update. Jefferson County is sitting at the top of probably the lower third of the state of Colorado. We are doing very well for our case counts, thanks to the vigilance of our community. One of the big changes I believe you've seen and we've been continuing to report on is the use of the CDC community levels in driving decisions as it relates to COVID mitigation measures. We have continued to be back into the low level of that CDC community level. That means our case counts are below 200 per 100,000 on a 7-day moving average, and our hospitalization numbers continue to stay low. This is a great indication, and as you can see, a lot of the state is also in that CDC community level low. One big change that was made over the last week is the issuance of guidance by JCPH, the State Health Department, and the Centers for Disease Control and Prevention in Atlanta. CDC on Thursday afternoon changed the guidance that they have removed for the general public and all settings There is some healthcare specific guidance that will be coming out. We were told on Monday that we were told on Monday that healthcare specific guidance and congregate living guidance will be coming out. We will look at that closely to see if they've removed requirements for quarantine from those very specific settings as well. And we'll make sure that you have that information if that does change. But for now, the guidance has been to remove quarantine from all areas, all guidance, all recommendations for quarantine. It was asked on the call we had with the CDC why this occurred. A lot of that change has been made due to the high level of immunity that exists within the population, due to vaccination coverage, prior infection, and prior infection with previous variants. So with that high level of immunity that is in the community, the CDC has taken the first steps to moving to endemic disease and integrating COVID-19 into more of a routine infectious disease response. The first step in that is removing quarantine. That's not to say that quarantine is not an option for public health response if and when it is warranted, but it is no longer warranted for COVID-19 response. So we have updated our JCPH guidance for school settings to provide links and information and helpful points to the school settings across the community who are operationalizing all of the COVID guidance that is issued by our partners at the state and federal level. The key points in all of the guidance at our level, the state level, and the federal level is that it is a layered approach, as it has been. But this layered approach has switched to knowing your risk, vaccination, staying home when you're sick, hand hygiene, and ventilation. And so the guidance that has been issued speaks to all of those points. It also speaks to utilizing the CDC community levels to drive that decision-making process and to collaborate with the JCPH infectious disease EPI team so that these settings are able to make the right decisions for the setting and the nuances of the setting that they have. Really, this provides a simple guideline. We stress the collaboration, we stress the CDC community levels, and stressing that this is a layered approach based on those CDC community levels. Right now, we are in CDC community level low, so we would expect that just the standard messaging about infectious disease illness, stay home when you're sick, and use good hand hygiene are quite appropriate for that situation. The guidance is available on our school and childcare section of our website. The link is on here, and that is all I have for today.
Thank you, Christine. And thank you for your persistence. I know we had a little bit of trouble getting the information you were requesting from CDPHE and CDC. So thank you for your persistence in getting everything updated. Questions from the board members for Christine? I'm not seeing any hands go up. Thank you, Christine. Okay, now it looks like we will hear from Allison and Lucy on the Safe Infant Feeding in Emergencies project, local to statewide.
Thanks so much, Sherry. Just getting everything pulled up. Can you hear me okay?
I can, but it looks like Sherry might have frozen.
Okay. Hopefully Sherry will be back soon. If everyone else can hear me, I'll just go ahead and get started. Thank you again for letting us share a quick update about our project. This is a project that's been going on for a few years, and we've had some updates this year, and we're excited to share today with you. I'm Allison Wilson. I'm a Strategic Initiatives Coordinator here at JCPH, and I have Lucy co-presenting with me as well, Lucy Gareca. I'll let her fully introduce herself, but she's a community navigator, a safe feeding volunteer, and a contracted community engagement specialist. She does a lot of amazing work with the community and with us. So excited to share a quick update with you all.
Sí. Oh, buenas tardes, mi nombre es Lucy Huereca y voy a estar aquí compartiendo con Allison acerca de las emergencias para la alimentación segura en niños pequeños. Gracias.
All right, well, just a very quick background of our project and a question that we actually asked ourselves a few years ago when we realized this was a gap. You know, when emergency planning plans and information has been done in the past, historically, the infant and pediatric population hasn't always been prioritized, surprisingly. And I think we've seen that as a nationwide gap, and it is getting better. And there's a lot more collaboration happening worldwide and nationally, but we really want to prioritize, obviously, infants because they're a vulnerable population. They rely on their caregivers for food and survival during an emergency. And really, it can be quite simple if a parent has the correct supplies or support to continue safely feeding their infant. But obviously, an emergency is a very intense, scary situation. And we just wanted to ensure that we had a formal plan locally when we looked at this and started it several years ago. We know that if a parent's already able to breast chest feed their infant, continuing that relationship provides really the safest, cleanest method of food. It's very easy in the sense that it doesn't require supplies to prepare. It's warm, readily available. And then when we think too about our infants that are receiving breast milk substitutes and formula, we really want to prioritize them to ensure a family has the correct supplies to prepare that formula, that they've had a feeding assessment so they can access the correct formula when they're in a place that's not their home during an emergency, whether that's at a shelter, potentially with a family member, or at a hotel. So really just ensuring they can talk with somebody to give them guidance and also getting the correct supplies. This is something that's, like I said, it's improving as far as more planning is being done for this population. But, you know, when we sat down back in 2018, it was actually Christine Billings, myself, and our colleague, Paulina Erices, our former colleague, Paulina really brought to our attention that we in Jeffco didn't have a formal plan in place. So that was really our first step that we did. We have a written plan that now lives with our emergency support function 8. Plan. So when an emergency happens, we have a way to support families. And then back in 2019 and 2020, we were able to train 2 sets of volunteer groups. And these are volunteers that already work with families around feeding support. And Conectando and Cuenta Conmigo were a huge part of this, and Lucy will speak more to that even then, with our helping us create this training for volunteers to then be able to either go to a shelter in an emergency to support families, or even now potentially talk with someone over the phone or also by Zoom, but just again, provide help with a family to answer questions and ensure they get the correct supplies. We also made some kits then that would be available to give out to families in emergency if needed. We of course had to adapt, as everyone did during the pandemic. We did more work with our volunteer group. They're shown here as part of our volunteers. We did a lot of support around lactation and feeding in the time of COVID. But this last year, we were able to kind of get back to some of our original goals of expanding our project from a local regional effort to really cover the entire state of Colorado. So over this last year, that's been a really big focus. And the Rocky Mountain Medical Reserve Corps has been an amazing partner in this. Veronica Moody and others there were able to help us think about what would this look like to replicate the model that we had locally to then be available and adapted statewide to the various needs across Colorado to ensure all of Colorado could access this in an emergency. we received an award from the National Association of City and County Health Officials around building resiliency between emergency preparedness and maternal child health. And that really just helped us continue, again, what we had already wanted to do in expanding this. And our Safe Infant Feeding project that we had, again, with our trained volunteers and kits, we basically were able to have a lot of meetings over this last year and update our training, increase our supplies, and really develop that into a full mission-ready package. And that is a training plan that's going to live with the Medical Reserve Corps, and they're able to help facilitate logistics and training, and they're able to have that mission-ready package ready when an emergency manager needs to request that in an emergency in any part of the state. So one of the things I mentioned that we worked on, we did a lot of behind the scenes updating our training and materials, but also our kits. We had 30, like I said, and in partnership with our amazing partners in New Orleans and the state of Louisiana, who is doing really similar work, we ended up purchasing more family kits with our award and leverage funding. And they have a great infant ready kit that we really loved for the portability and design. They allowed us to adapt their booklet to Colorado. That booklet goes in the infant ready kit. So we now have more kits ready in an emergency to cover the state. And again, those are going to be distributed through Medical Reserve Corps as needed, but we're very excited about that. And our supplies here just show what's in the kit in the middle. We really keep that simple for portability and what would be essential in that first 48 hours after an emergency. And then if a family has a feeding consult with one of our volunteers and realizes they need more specialized supplies, on the right there you see more supplies we have on hand that can be deployed through our logistics team member to that family or to that shelter. And on the far left, we have just some of our portable lactation and feeding stations that are also available. So that's just a bit about what we've been working on to expand our project. I'm going to let Lucy speak now to her work and guidance around transcreating our training fully into Spanish and looking at how we can expand this even more in our community.
Thank you, Allison.
Sí, continuando un poco con lo que acaba de comentar Allison, nuestros aprendizajes es que desde el 2018, cuando yo asistí a la primera capacitación de alimentación infantil segura, me dio tanta emoción que inmediatamente pensé en que la comunidad de habla hispana debería estar recibiendo este tipo de aprendizajes en su propio idioma, ya que al hacerlo estamos brindando educación, información y así podremos tener más voluntarios que estén dispuestos a apoyar a otras comunidades en el lenguaje de su corazón. Es muy importante agregar diapositivas de alimentación infantil segura a otras capacitaciones como la de preparación comunitaria y ustedes, porque eso va a ayudar a comprender los componentes de la alimentación infantil durante la respuesta de emergencia para poder evaluar y actuar. Se pueden apoyar las necesidades nutricionales y el cuidado de los bebés y niños pequeños. Esto nos va a ayudar a educar e informar a la comunidad en su propio idioma, a utilizar equipos familiares y suministros de alimentación segura, brindando ayuda básica para la lactancia materna con las familias en los albergues. Se pueden entender mejor cómo es que debemos prepararnos para así ser un buen recurso individual, familiar y comunitario para actuar en casos de emergencia. Y esto es gracias a ustedes por hacer esto posible. También hemos creado un grupo de apoyo completamente en español, que es Cuenta Conmigo Lactancia. Este es un grupo que se ha dedicado exclusivamente para familias de habla hispana, ya que muchas veces ellas no saben que hay estos recursos y de qué manera ellos pueden contar con ello. La siguiente, por favor. En el mes de mayo se dio entrenamiento al proyecto de acceso comunitario a la lactancia a un grupo de chicas del norte del estado que ellas tienen contacto directo con personas embarazadas, lactantes o con niños pequeños que hablan español. Y estamos súper emocionadas de que este próximo 27 de agosto, alrededor de 20 participantes obtendrán la formación necesaria de la alimentación infantil segura en casos de emergencia completamente en español, y así podremos tener más voluntarias que puedan ayudar, apoyar, educar e informar a otros miembros de la comunidad a obtener esta formación. La siguiente, por favor. Y el próximo 24 de octubre, algunos de los voluntarios de alimentación infantil segura participarán en un ejercicio completo de práctica de emergencia con el Cuerpo de Reserva Médica. Esto forma parte del paquete listo para la misión, y después de este ejercicio estarán listos para implementarse a través del MRC, el Cuerpo de Reserva Médica. ¿Alguna pregunta?
Thank you, Lucy. And thank you, Diego. Are there questions from the board? I am not seeing any hands go up. That's a great program. Thank you for the work that you're doing. Oh, Lane Drager, you have your hand up.
All right, couldn't get the hand clicked fast enough. Do you have a sense of kind of the need in the community at this point, and sort of what our planning capacity is? It kind of on par with what your expected need of the community has?
Lane, I can start, and if Lucy has anything to add just from her closer work with Latinx community. And I want to make sure I understand, are you saying specific to what would be the need in an emergency to support families?
Yes.
Yeah, we kind of based our data on, we looked at like number of babies born in Colorado each year. And when we first looked at it, we looked at it specific to Jefferson County when we did our planning. Over the last 3 years, we haven't fully deployed our team yet, but we think that could be partially, we want to make sure that everyone knows about the program, and Christine's done an amazing job of sharing it with our specific region. I think now with the funds we received this last year and the additional kits, and if we look at emergencies in our states and others when they've had to provide supplies to families specifically around safe infant feeding, we definitely feel much more prepared. And the fact that we can now support families potentially virtually, at least initially, is a big win, because we had a lot of remote areas where it would be harder to get to families. So I think after this last year, it feels like we're a lot more ready, but of course we're looking forward to increasing our volunteer base over this next year. And we're hoping to have kind of pockets of volunteers throughout the state specific to their communities. And Lucy, did you want to say anything specific to your work with Cuenta Conmigo?
Creo que en Cuenta Conmigo, nuestro objetivo principal siempre ha sido la lactancia. Ver que esas personas que cuando asisten, están en una emergencia y asisten a algún albergue, no sea su primera opción fórmula, sino que haya entrenamiento de personas capacitadas para que puedan proveerles ese apoyo que ellas necesitan para seguir lactando a los infantes, porque nosotras confiamos en que esta es la mejor manera de cómo un bebé puede alimentarse. No excluimos la fórmula, pero creo que sí la lactancia es lo primero, si es que en su casa o en su hogar es el primer alimento, entonces queremos continuar con eso. Este grupo de Cuenta Conmigo, nosotros queremos tener más opciones para poderlo brindar en más áreas del estado, preferentemente en el área metropolitana, pero igualmente con este grupo que se creó de la capacitación que dimos en mayo, queremos abrirlo también afuera del área metropolitana, como es Greeley, como es Fort Collins, como es Longmont, de que ellos mismos tengan estos grupos de apoyo, ya que hace falta muchos recursos que puedan ayudar a estos grupos. Gracias.
And I just want to mention too that, of course, the dream would be that anyone that has a child in Colorado would maybe receive a kit. So that's something obviously we'll keep looking at funding. They're fairly inexpensive. They're about $30. So it'd be great if that could be a proactive measure because it's something that's still useful in that first year, but something to shoot for. Or if you know of additional funding.
Yeah. Thank you,
Thank you so
Allison.
much.
Are there more questions? Okay, now I'm not seeing anybody. Just speak out, board, if I don't see you. Well, thank you for the presentation, Allison and Lucy. Very much appreciated. Okay, if there's no other questions before us, we will adjourn this portion of the study session and we'll go right into our business meeting. So we'll adjourn at 4:03. And we will then call to order the business meeting at 4:03 and a half. Okay. Lindsay, can we get a roll call?
Yes. Harriet Hall,
Present.
Kimberly Kroppick,
Present.
Blaine Drager,
Present.
Sherry John,
Present.
and for the record, Hilda Gerke is absent and a quorum is established. Thank you.
Thank you, Lindsay. And of course, the very first thing that we want to do is turn it over to our language justice folks. And it is today, Diego and Gisela. We always want to make sure that we have language out there so everyone can participate that wants to tune in and listen or has any comment. So with that, Diego, are you going to be up or is Gisela? Did we lose them? For the interpretation, yes, yes. The language justice interpretation. Gisela, is that you?
Yes, ma'am. Thank
Okay,
you.
there she is.
Hello, everyone. My name is Gisela Escobedo, and I'm here with Diego Pons, and we are with the Community Language Co-op. And I want to say thank you to the organizers of this event for your commitment to language justice. Thank you for giving an opportunity where people can participate and engage in the language of their heart, the language that they feel most comfortable in, that it's the language that they practice at home. So to create this space, we're going to be using simultaneous interpretation. So when I finish saying this in Spanish, we will turn on interpretation and you will see a globe icon on the bottom of your bar that says interpretation. If you're not fully bilingual, I ask that you select your preferred language. If it's English, English, or Spanish, Spanish. And if you're fully bilingual, you don't have to do anything. And if you're joining us today from a phone or a tablet, it has 3 dots on the bottom of your bar that says more. You can click on it and then you can select your language as well. And if you're going to be presenting or facilitating, please be aware of your speed, knowing that Spanish takes 20 to 25% longer than English. Hola a todas las personas, mi nombre es Gisela Escobedo y estoy aquí con Diego Pons y estamos con la Community Language Co-op y quiero darle las gracias a los organizadores de este evento por practicar la justicia del lenguaje. Gracias por crear un espacio donde las personas pueden participar e involucrarse en el idioma de su corazón, en el idioma en el que se sienten más cómodos, que es el idioma que practicamos en casa. Así que para crear este espacio vamos a estar usando la interpretación simultánea. Cuando termine de decir esto, vamos a aprender interpretación y usted va a ver un icono de un globo en la barra de abajo de su pantalla que dice interpretación. Si no eres completamente bilingüe, te pido que selecciones tu idioma preferido, ya sea inglés o español. Y si hoy estás desde un teléfono o una tableta, vienen 3 puntitos igual en la barra de abajo de tu pantalla que puede decir más o more. Le puedes dar un clic ahí y después seleccionas tu idioma. Si estás hoy con nosotros desde el teléfono, pues seleccionas y si vas a estar hablando o presentando, por favor, sé consciente de tu velocidad. Muchas gracias. Thank you very much. You can go ahead and turn on interpretation.
Thank you, Gisela. And if we'll all go down to the little globe and check your preference. Okay. We have the consent agenda next on the list, and on that consent agenda, we have acceptance of the agenda, approval of the July Board of Health meeting minutes, and the approval of warrants. Is there going to be any discussion on any of those that they would need to be pulled off the consent agenda? Nope. Okay. Then may I get a motion to accept the consent agenda as it is written?
Moved.
It has been moved. I think, Lane, you seconded that?
Yes.
Okay. Thank you. And now we'll move right into public comment. And just a
We just need
note.
to vote.
Oh, no, yeah, we do need to vote. Let's vote on that. It was moved, it was seconded. Now we need to vote. All those in favor, please say aye.
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 Any opposed, please say no. Motion passes. Okay, now let's move to the public comment. And just a quick note to remind everyone that we always do have people sign up before the board meeting. We left it open a little bit longer this time because there had been a glitch, but everyone that is signed up, you will be called. Anyone that didn't get signed up, please send us an email because we do want to hear what you have to say. And then just a reminder, public comment is a time for the community to provide comment on issues they would like the Board of Health to be aware of. The board does not provide feedback to these comments during this agenda item. However, Jefferson County Public Health staff are standing by to address any data questions. So we are here to listen. We're here to take notes. Please give us your feedback or things that you want us to know. And let's move right into that. Lindsay, would you call the first person, please?
Sure, Josh Schlossberg, and you should be able to unmute.
Can you hear me?
Yes, we can.
Okay, I'm speaking on behalf of Colorado COVID Watch. So Pema Chodron, Buddhist teacher, wrote, "When inspiration has become hidden, when we feel ready to give up, this is the time when healing can be found in the tenderness of pain itself." Over the years, federal, state, and local governments, and more recently, most media have ignored epidemiologists and those of us advocating for actually doing something about the ongoing spread of COVID-19 because of that unprecedented levels of pain have been or still being felt around the world. While some of this spread may have been inevitable, countries such as Japan, New Zealand, and others prove that the US chose to allow hundreds of millions of infections, tens of millions of cases of long COVID, over 1 million deaths. And those of you appointed to the Jefferson County Board of Health are exactly the ones who could have limited that suffering, sickness, and death, but you chose and continue to choose to shirk your duties, or in the case of your appointed president, actively oppose life-saving public health measures. Why? We understand that most corporations are set up to care only about profit and that a good percentage of our citizens are so psychologically stunted and ideologically possessed they can't make the slightest sacrifice for the public good, even the good of themselves and their families. But how could most of the rest of us, those who know better, have allowed this to happen and still happen? I grew up as a Jew, going to synagogue and Hebrew day school, getting bar mitzvahed and studying the Holocaust. I understood why Nazis wanted more land, but I couldn't understand how the average German, who was probably a decent person, could allow their government to murder 6 million of my people, several million others on top of that. How so many French citizens supported or even joined the Vichy government, the puppet regime that collaborated with the Nazis to look the other way as it exterminated Jews and oppressed its own people. Now, thanks to COVID, I understand. When things get tough, humans either fight, flee, or freeze. Some of us have fought and continue to fight COVID. Some, such as the Jefferson County Board of Health, have fled from COVID, but most of the rest of the population, as did most Germans and French, have frozen. It's been too hard to admit, not just the impact of this virus, but how we've actively chosen to let it spread and are still doing so. All that blood, all that virus on our hands is just too much to process. So we choose denial. It's not too late to turn things around in the world, the US, Colorado, Jefferson County, and in hopes that Jefferson County Board of Health will stop fleeing from sickness, whether it's COVID, monkeypox, and now polio, and start fighting as you've been tasked to do. I'll leave you, the folks who hold our health and lives in your hand, with the words of Pema Chodron once again. Take the pain of the world in, let it touch your hearts, and turn it into compassion. Goodbye.
Okay, next up is Tom Hughes. And Tom, you should be able to unmute.
Yes, thank you.
Sure, we can hear you. Go ahead.
I'm Tom Hughes of the Rotary Club of Golden. I head up the club's mental wellness work group committee. I'm also a member of the Communities That Care organization, which I joined primarily because it was led by Pamela Gould, who impressed me, still does, as an effective and insightful leader who had a cause that was worth following. Pamela and I have worked together on several projects, the most recent and important of which is a presentation made about a week ago to the Golden City Council regarding a series of programs actually, to prevent mental health disorders occurring to the extent possible in Golden teens. We're waiting for the council to make a decision on whether they will fund that program. Unfortunately, subsequent to that, I learned that the Board of Health, Jefferson County, has reversed itself on funding for communities that care, and putting all projects that organization has been pursuing in doubt. And even worse, perhaps, as I understand, Pamela Gould has resigned from Jefferson County Public Health. We're losing a wonderful person. We need more people like Pamela, not fewer. So in her absence, I'm kind of stuck as to what we're going to do for the Communities That Care organization. And I hope the board would find its way clear to reverse its position, allow that organization to thrive, and provide the funding it needs. Thank you.
Thank you, Tom.
Okay, next up is Pamela Gould. And Pamela, you should be able to unmute.
Hi, everybody. Tom, thank you for those lovely remarks. My name is Pamela Gould that Tom was just talking about. I've been an employee of Jefferson County Public Health for 7 years, 5 of which I have poured my whole heart and soul into working with the amazing Communities That Care Coalition. Our coalition is made up of community volunteers like Tom that you just heard from, a lot of youth, some of whom I believe are on this call, and agency representatives. Our goal is to reduce risk factors that lead to mental health problems, violence, and substance misuse among our youth. I want to tell you about some issues we are having related to fiscal sponsorship. Last February, at the request of my grant monitor from CDPHE with the Coalition's Organizing for Prevention grant, he recommended that our coalition take a look at who is our fiscal sponsor, and therefore we embarked on a complex process. I talked to my supervisor at the time continuously during that process, and in fact was awarded with Employee of the Month during this process. In March, I talked to our CDC grant sponsors, And an MOU was signed between the coalition and Jefferson County Public Health that stated that upon immediately and without further approval processes, that Jefferson County Public Health will relinquish the role of fiscal agent upon vote of Jefferson County Communities That Care Community Board members per coalition bylaws and signature of MOU with a new fiscal agency, transferring of fiscal documentation, accounts, accounting, and responsibilities to selected fiscal agent. I think the really important word there is immediately. In May, I talked to fiscal staff of Jefferson County Public Health. In June, I sat down and had an in-depth conversation with the senior leadership team. In July, I talked to you all at the Board of Health meeting and talked about our timeline. I was repeatedly told this should happen quickly and that people were not concerned. Suddenly, 3 weeks ago, I was told that there were vague concerns and complexities and that we would have a lot more issues than expected initially in making this transfer. This is after a lot of assurances that it would go quickly. As staff liaison and an expert in these grants, having written them and maintained them for 5 years, I was completely stonewalled and left out of this process of trying to figure out how to make this work. Instead, my understanding is that as much as $20,000 in legal fees has been spent and countless hours of Jefferson County public leadership. After 2 months, we have not been able to get signatures on 3 items that total less than 3 pages of text. I'm asking you to make that happen immediately tonight.
Okay, up next is Tiffany Buchan. And you should be able to unmute.
Yes, thank you. Can you hear me?
Yes, we can.
Excellent. My name is Tiffany Bucknam. I am here to request that the board release the Communities That Care grant funds to a new fiscal agent tonight. I serve on the board of 12 Talks as a community advisor. I play a parent role. I'm a parent of 2 Jefferson County teenagers, and I am a social worker with a background in community organizing. In my previous career, I staffed a grant-funded coalition-based project called Colorado Covering Kids and Families, the administration of which was originally housed with the Colorado Department of Public Health and Environment, and was moved later under the fiscal oversight of 3 nonprofits so that the work that we were doing could be closer to the communities that it served. The transition was awkward. There were hard feelings. But it took a project that was doing excellent, important work and meeting all of its benchmarks and elevated it to one that received national recognition for excellence in community reach. It is the nature of community work that it improves in its efficacy the closer to the community that it gets. And that is the reason why all of those of us involved with Communities That Care are voting and urging the board to move our grant funds to a new fiscal agent. In my time, I've run into a couple of things with 12 Talks that I wanted to share specific that I think would be helped by this move. 12 Talks is a really cool project. I don't know how familiar you are with it. It does outreach to parents to improve parents' ability to have conversations with their youth around issues like alcohol and drug use and relationship violence to diminish their youth's risk factors. It's an extraordinary intervention that reaches across class and color lines. All parents want to do better for our children. I'm sure you also know that parents of adolescents are dang busy, and the stress of that work is enormous. Ease of administration of this messaging to parents is of the essence to make this intervention work. One of the ways that I know that parents are gathered, one of the easiest ways to reach them is through informal school Facebook pages, things like sporting teams or social networks for parents. And it would be so easy to take 12 Talks messaging on Facebook and share it. And yet we can't do that because it is prohibited by department regulation. I also think that moving to a new fiscal agent would ease the administrative burden of participating. There is a fairly substantial administrative burden to participating in the compensation provided to community volunteers. And I believe that moving to a new fiscal agent will ease this. If we want to attract higher risk community members to participate, we need to make this easier. please make this move.
Okay, next up is Mandy Lay. And Mandy, you should be unmuted.
Can you hear me?
Yes, we can.
Okay. My name is Mandy Lee. I am a member of Jefferson County Communities That Care and the Golden Anti-Racism Collective. I've been working with and learning from Pamela along with the other community members of the CTC for about a year now. In that short time, I've witnessed CTC collaborate with young people throughout Jeffco to envision and implement events, policies, and projects that improve health outcomes and reduce risk factors for teens. All that is to say, CTC does valuable work for Jeffco youth every single day in this community. I ask that you respect the CTC's decision to change fiscal agents and release our coalition's grant funds to our grant sponsors so that we may continue cultivating a thriving, healthy, and safe community for young people. This time of year is so valuable for teens to feel safe and supported at home, at school, as we embark on a new school year, and throughout the county. CTC is already doing that work as agents of safety and belonging, and we ask that we are able to continue that important work in our community. Thank you.
Thanks. Up next is Amy Craddock. And you should be able to unmute.
Hello?
Hi, we can hear you.
Perfect. So this fiscal agency move was originally supposed to be Jeffco CTC's next step in engaging and aiding youth in our communities. I am one such youth. I am a junior going into Lakewood High School, and that this move appears to have become stagnated and, quite frankly, a power struggle is deeply concerning to me, as I have witnessed how much effort and CTC as an overall coalition with moving parts have put into coordinating and making this transition real. As a Jeffco youth, once again, it is my hope that the Jeffco Board of Health will respect the community that CTC only wants to expand via this move. Thank you.
Thank you. Up next is Charlotte Combe. And you should be unmuted.
Hello.
Yeah, we can hear you.
Awesome. My name is Charlotte Combe. I'm an incoming freshman in college and previous youth intern for the Jeffco CTC, and I have been for the past 2 years. On my last day of work as a summer intern this year, I helped to facilitate a meeting where our coalition voted on whether or not to move to another fiscal agent, where an overwhelming 93% of members voted that would be the best option to move. So I was confused a couple of weeks later when, against our community's wishes, I heard that JCPH leaders have refused to move forward with the Jeffco CTC's change to a new fiscal agent. What's more, I was extremely upset to hear that the deputy director who came to our coalition meeting, who heard from me and other young people and our coalition members, the best option for Jeffco CTC to make an impact was to move, that he has decided now that our voices don't hold weight in this decision because it's up to him, the county attorney, and the Board of Health. Well, over the past 2 years working with Jeffco CTC, with Pamela Gould and Emily Merriweather, they have empowered me to use my voice as a young person, even when I'm made to feel like it doesn't matter. So that's what I'm going to do. As a young person who has been positively impacted by the work of Jeffco CTC, I believe that the coalition would better be able to help young people if they moved fiscal agents. Firstly, it would make internships more accessible for all young people. The Jeffco CTC routinely employs around 60 high school age youth from across Jeffco as interns for every school year. As of now, there are huge barriers for teens if they want to work with the Jeffco CTC. For instance, among many documents youth had to sign to work, they also needed them to be notarized. There were many young people who wanted to get involved but could not because of barriers like this. In addition, interns do not get paid for their work until the summer, months after they finish their internship. Not getting paid while working is simply not an option for many young people who may need to financially support their families or need more immediate income themselves. It's important to ensure that pro-social opportunities aren't just provided to youth who can afford to work without immediate income. Secondly, the Jeffco CTC employs around 3 youth during the summer to complete bigger projects for the coalition. The onboarding process alone to become a summer intern takes at least 20 hours. This, of course, makes sense for long-term employees of the county. It does not, however, for young people who often have the summer internship as their first real job. I know personally, I have not participated in various opportunities through JCPH because of high barriers created by the onboarding process. All of these barriers and processes would be streamlined by moving to a new fiscal agent, allowing more young people to get involved more easily. People like Pamela Gould have inspired me to one day pursue a career in public health myself. But if there is this lack of equity, power sharing, transparency, and truthfulness all across the field, I'm not sure if I want to. Thank you.
Okay, next up is Mark Spiroff. And Mark, I believe you're unmuted.
Hey everyone.
Hi, we
Right,
can
this
hear you.
this is Mark Spiroff, and I'm the guy who developed the new community radio station serving the U.S. Highway 285 corridor here in Jefferson County. And I'm here simply to share that as a new volunteer CTC Communities That Care board member, we voted earlier this month to move to a new fiscal agent. And I believe that that vote was overwhelmingly in favor of making this move for a number of well-articulated reasons that I won't go through here. But I'll simply recommend that the county respect the vote, its outcome, the need to do this, and move expeditiously to facilitate this move. And I yield my time to the next individual. Thanks.
Okay, thank you. Next up is Mary Beth Godwin. And you should be unmuted, Mary Beth.
Hi, this is Mary Beth Goodwin. Thank you for calling me in. I actually did not submit my name for comments. However, I am Mary Beth Goodwin from Community First Foundation and have been recently introduced to Jeffco Communities That Care Coalition the last several months under the leadership of Pamela Gould, and have been very inspired and impressed by the community-led efforts by her and the coalition, and what I understand to be an overwhelming support of the transition of fiscal sponsorship outside of JCPH. So I as well have been a little surprised by recent developments, and I'm truly listening in to hear community feedback and comments. So thank you for calling me, and I will defer my time to others. Thank you.
Okay, thank you. And that's all that I have for signed up for public comment, Sherry.
Thank you.
Sherry, this is Kimberly. Sorry, my camera keeps going. Yeah,
That's
hi,
okay.
sorry, my camera keeps going in and out. I don't know what's wrong. Do we need to read into the record the 2 public comments that were submitted in writing?
Or do we just attach those to the minutes for the public to read?
You're cutting out really bad. I think you asked, should we read the ones, there was 2, I think, that were submitted for in writing. Is that what you're
Correct.
asking?
Yeah, correct.
Okay. I believe, Lindsay, you have those.
I do. Carrie, can you tell me if I need to read those into the record, or I can just attach those to the minutes?
I think attaching them as they were written to the is the appropriate way to proceed.
Okay, thank you.
Okay, we will make sure they get attached into the minutes. Okay. Any other comments? And I will just say that I hope everybody can take a deep breath. The is just now coming to the board. We've not had any meetings since obviously our last board meeting. So we're also, this is an issue where we're trying to collect information. And so we appreciate all of you coming to share your love for the CTC. I think everybody shares that love with you, but we can't make any decisions because we don't have any information. So we are now moving into that phase, and this will be an issue that we will take up.
Hey, Sherry, maybe we could get an update from Jody, just so it's more
Yes.
timely instead of waiting till later in the agenda.
Yes, that was my next comment. So Jody, I think you are on. Can you kind of fill the board in a little bit?
Yeah, thank you so much. I think having the opportunity to do this at this point in the agenda is going to be very helpful. I really appreciate the time. There's a lot of pieces to this, and I'm not exactly sure where to start. I mean, it was exactly a month ago that I came to you and said, I support this move and this should happen fairly quickly. And I meant that 100%. And then I think it was either during that meeting, maybe immediately after my comments, that I had seen an email response from CDPHE. The county attorney's office had requested that we reach out to them and say, hey, we're ready to make this move. Any final issues before we make this move? And they said, well, we're going to need some information first. We are going to need to, we have a lot of questions and we need to talk about this internally before we move forward with this. And that resulted in a call between their fiscal staff and our fiscal staff about a week later. So about a week and a half after the last board meeting. And they said, at the end of the day, the people who make decision about this funding move weren't in the room. That was going to be the CDPHE attorney's office and some other higher level program staff that would have to be having those conversations. So we had that meeting, me and John Biondi with CDPHE last week. And at the end of the day, the question that's come up, I think, from all the commenters is that the Board of Health should move this funding. And I thought about just immediately turning this over to the county attorney's office to answer the question about whether you have that authority. And the answer is you don't. You don't have that authority. You don't have that ability to tell CDPHE where to give their funding to. And that was the question that we asked them. Are we able to say, give this funding over to this new organization? And they said, this is competitively awarded funding. JCPH receives this funding because we go through a financial risk assessment. We have really good record with them. We're a county organization. That's why we get the dollars we get from from the state, from the federal government. The CNDC might not have received this through competitive funding. And so that was a huge red flag for me to think, okay, we're talking about shifting this program over, but the funding might not be able to go with it. And so I could have, washed my hands of it at that point and said, you know what, I'm going to sign these documents and just let it go. But that bothered me because this has been a fantastic program. This has been great work. And despite what I've been through, which is really honestly 80% of my time over the last month, and the county attorney's office has been absolutely fantastic. John Biondi has been in lockstep with me, available constantly, very responsive to every question, every meeting, every call that I've asked him to be on. And at the end of the day, the question isn't about, there's transfer versus terminate. So at the end of the day, if the board decides down the road that we don't want to do this work anymore, we're going to terminate these agreements. It's not going to be to transfer these agreements to a new organization. We will be terminating these agreements per the county attorney's office and advice from the county attorney's office. So the question for me then became, can we try to time this right? Can we try to time this so that CDPHE, if they so choose to award this funding to CNDC, that it's timed just right so that we can shift staff, that they can do whatever they need to do so that there's not a gap in the funding. Again, I could just right now say, you know what, I recommend to the board we terminate we have a CDC grant, 2 state grants. I recommend that you terminate those grants and we let the CTC board and CNDC pick it up from here. But that wouldn't be holding true to my values of really wanting to support this program. And again, to get raked over the coals, honestly, to get beaten up about it, it has been hard. But for me, I wanted to make sure that there wasn't a gap in this. And to do that required an immense commitment of time, an immense commitment of energy. And anybody in this building will tell you that this has been almost my entire dedicated time over the last month to this project and making this happen. So I had what I would call a fruitful conversation with the executive committee with CTC this morning. We talked to them about where we are in this process. I'm happy to connect them with the people we're having conversations with at CDPHE. Happy to and we really hoped, John and I went back and forth multiple times about, do we have an executive session after this meeting to update you? But we wanted to get just a few more details so we could paint a really comprehensive picture of the decisions that you'll have to make about if CDPHE says we will not award this funding to another organization. This is public health funding. We will ask you if you would like us to keep doing this work. Or if maybe one of the grants CDPHE is willing to fund to another organization, do we keep a second grant and continue to do some complementary work? Still some questions around the CDC grant and how we should go about working through that as well. So it's been a complex process. It's been a difficult process. And this is really, we'd hope that CDPHE would just give us the green light and say, yep, just tell us when you're going to terminate and we will award these dollars to CNDC. If that had been the case, I would be here tonight advising you to sign those termination agreements so that this can move forward. That's not the case. We still have CDPHE that has to answer some questions about whether they even would fund CNDC as a project. And we're waiting for, and I need to follow up with them probably tomorrow to see exactly where they stand. There's 2 different grants, 2 different projects, and one of them has indicated that they could potentially move. It's the one we refer to as the CTC project. And then there's another one that's a health equity project that they've said, yeah, we see this as public health funding and don't see the value in reassigning these dollars somewhere else if you terminate. So that's really where this is at the end of the day, honestly, is that a lot of it's been out of our control. And we, again, Jean and I have been, and Joe Battlepour, Salma Jacane, the amount of time, energy, hours we've committed to this has been absolutely astronomical, but it's all because we love the project. It's fantastic work. We want to keep it going and didn't want to see a gap in that service. And then with that, I'll see if you have any questions.
Thank you, Jody, for the update. And it sounds like there's a lot of information still to collect, and details and stuff to work out. So we'll look forward to you keeping us advised and posted. I appreciate that.
Thank you.
Sherry, can I ask a question of Jody for clarification? Just because I'm a little confused on one thing.
Okay.
And please tell me if I'm cutting in and out. I shouldn't be. So Jody, I'm confused with, you said the board doesn't have the responsibility or capability of these grant funds, but then towards the end, I heard that we do have a responsibility to tell Jefferson County Public Health whether we want to terminate or continue to use those funds within JCPH at another on another parallel or complementary project. Am I understanding that correctly?
Yes, thank you for that. So at the end of the day, we are the contracted agent with CDPHE. So the contract is between Jefferson County Public Health and Colorado Department of Public Health and Environment. So at the end of the day, again, if CDPHE comes to us and says, yeah, we're ready to fund this new organization, are you ready to terminate these grants? At the end of the day, if you went to CDPHE and said, we're not willing to terminate these grants so that you can give them to another organization, that is a choice that you can make. I would not advise you to make that choice. If CDPHE comes to us and says, one of these grants, we feel like we can move to another organization, but this other one, we cannot, then the choice has to be with the Board of Health. What I would advise in that case is, let's by all means, let's write a termination agreement that's timed just right so that the grant that they agree to fund to this new organization could be moved just when we terminate, they pick it up and they're ready to go. But the second grant that they may not be willing to move, we may have to decide, do we want to keep doing any of that work on that grant, or do we just want to terminate that grant as well? And so really, because again, we're the funded agency, we're the contracted agency, that responsibility is ours to decide. If CDPHE says, no, we're not willing to fund this organization at all, do we still decide to terminate those agreements and say we're going to stop doing this work altogether in this county if CDPHE decides that this is public health funding and that they're not going to finance a new organization with these dollars if we decide to terminate?
Thank you for clarifying.
Yep.
And I am going to move us on because actually this is public comment, and a discussion around all of this really should be like in an agenda item so that we can post it as far as on the agenda, which obviously we won't do tonight. So Jody, I think that we would like to have you keep us in the loop. If we need to call a meeting or something to further discuss this, but if you can please continue to gather information. I think it's in everybody's best interest to see we can't come out with a win-win. So
Thank you.
Thank you.
That's definitely something the county attorney's office had suggested, is that an executive session so that we can move this forward as quick as possible. Thank you.
That'd be great. Thank you. And thank you to all the people that are passionate about this issue and signed in to speak. And with that, we are going to move right on through our agenda and go to our financial report. Salma, I think you're there.
Good evening, everyone. I'm gonna go ahead and share my screen. Can everybody see the financials and hear me okay?
I think so.
Awesome. So today I will be presenting the July financial statements. And as of this reporting cycle, and with 58% of the year complete, our total revenues are being reported at 55% of the budget, so just slightly below budget by 3%. And that is mainly due to grant funding. In terms of our expenditures, salaries and benefits are below budget by 12%. As I mentioned during the previous reporting cycle, this is mainly due to vacancy savings and a hiring freeze that we currently have due to anticipated budget fiscal year 2023 budget challenges. Supplies, and we continue to surpass our supplies and direct assistance line item due to grant budget reallocations. Other services and charges are just slightly below budget by 2%. Capital projects and equipment are at 54% of the annual budget, and intergovernmental and or payment to states, which are associated with restaurant licensing and mortuaries, are at 40% of the annual budget. And interdepartmental charges, these are cost allocation and internal services charges, are just slightly ahead of the budget by 3%. And unfortunately, because we are behind of on our salaries and benefits budget, we are overall behind our total expenditures budget. However, one thing that I want to highlight is that this doesn't necessarily mean that we wouldn't be utilizing our full expenditures budget. Our senior leadership team and supervisors are working really hard to see what other alternatives to ensure that services are not impacted, such as contracting with other agencies to provide services or hiring contracted employees. I know that Joji is also working with the county to request additional funds or county transfer next year or resolve some of the challenges that we are facing in terms of fiscal 2023 budget, so we can start hiring some of those positions that are currently on hold. And as of July, we've utilized 37% of the county transfer allocated to GCPH. That's all I have, unless if you have any questions. And I think you are muted, Sherry.
There you go. Are there any questions from the board members before we move to have a motion to approve? No questions?
I'll move to approve the financial statement.
We have a motion to approve. Do we have a second?
I will second.
And it has been seconded by Harriet. We'll need to take a vote. All those in favor, please say aye.
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 Aye. Are there any opposed? Seeing none, that motion passes. Then the financial report has been approved. Now let's move straight to new business. I'm excited to have these two things on the agenda. Healthy Kids Colorado survey. Paige Fairchild, I think that you're first. Excited to hear about the stuff that has come through on that Healthy Kids Colorado survey.
Yes, going to share my screen. And
Everybody see the PowerPoint and not the presenter mode? All right, awesome. So thank you all for allowing me to speak with you today. My name is Paige Fairchild. I'm an epidemiologist with the Epidemiology and Planning program at JCPH, and I'm going to be presenting some data from the Healthy Kids Colorado survey. I'm going to go through a short introduction to what the Healthy Kids Colorado survey is, and then show you some data from that survey that relates to Jefferson County high schoolers' mental health, alcohol use, marijuana use, food insecurity, and housing stability. So the Healthy Kids Colorado survey is a comprehensive anonymous survey of middle and high school students in Colorado. County level data is available for the high. The survey is used to better understand youth health and the factors that help young people make healthy choices. It's conducted every other year in a sample of schools around the state. It covers 19 health topics, and there's over 150 indicators. And Healthy Kids Colorado survey dashboard is available for anyone to use on CDPHE's website. You can also just search for Healthy Kids Colorado survey. The dashboard gives more detailed information on statewide and regional results. You can go back previous survey years and look at different health topics and health measures. So I highly recommend that if you're interested, you can take a look yourself. Most of the indicators in the survey cover the health topics that I've listed on this slide. And while you're looking at that, I want to specify that Healthy Kids Colorado survey is supported by CDPHE and a team of researchers from the Colorado School of Public Health. So if the board is interested in more information on any of these health topics, we can definitely connect Healthy Kids Colorado staff to come and present additional data. And then some quick considerations before we dive into the results. I'm going to show charts that compare Jefferson County in 2019 to Jefferson County in 2021. The survey is designed to collect data from one point in time, so we can test statistically whether there's a difference between 2019 and 2021, but we can't make any inferences or conclusions about why the differences are happening. So that's just kind of a caution as we're looking at the results. If you see an asterisk, that indicates statistical significance, which just means that we have high confidence that the two values are truly different and not just different because of chance. And this isn't the same as practical significance, which would be something that's meaningful or important. This is statistical significance is statistical. And finally, I'm not showing Colorado 2021 data because for all the indicators that I'm going to talk about, Jefferson County in 2021 was not different from Colorado as a whole in 2021. Because of the breadth of the data that's available, and in the interest of time, I'm going to present indicators that align with JCPH's 2019 through 2021 Community Health Improvement Plan, also called the CHIP. So as a quick reminder, the priority areas for the CHIP are access to mental health and substance use treatment, food insecurity, alcohol and substance use, and housing. For the 2021 Healthy Kids Colorado survey, Jefferson County had a 69% response rate with over 5,000 high schoolers completing the survey. You can see that the breakdown of respondents by grade is pretty equally distributed, which is what we would hope. The Healthy Kids Colorado survey also provides disaggregated data based on several demographic subgroups, such as age, gender, gender identity, race, ethnicity, and sexual orientation. For simplicity's sake, I won't be discussing any results today by subgroup, but if the board, again, has specific questions about results by any of these subgroups, you can let me or our team know. All right, so diving in to mental health indicators in the survey. The percentage of students who reported feeling so sad or hopeless every day for 2 or more weeks in a row during the past year that it impacted their usual activities increased significantly in 2021 to almost 42%. Again, this is in Jefferson County. The percentage of students who seriously considered attempting suicide in the past year, we see a slight but not statistically significant increase to 18.5% in 2021. The same for percentage of students who attempted suicide 1 or more times in the past year, just a slight but not significant increase in that. And then the percentage of students who report that they have an adult to go to for help with a serious problem is relatively high in Jefferson County, 74.3%, and not statistically different than 2019. Looking at alcohol use, the percentage of students who had at least 1 drink in the past month decreased significantly to 22.5% in 2021. And then looking at beliefs around alcohol use, the percentage of students who think it's wrong or very wrong for someone their age to drink alcohol increased significantly to 64.5% in 2021. The percentage of students who think people who have 1 to 2 drinks nearly every day have a moderate to greater risk of harm also increased significantly from 80.3% or to 80.3% in 2021. Looking at marijuana use, the percentage of students who used marijuana at least 1 time in the past month decreased to 14.1%, a significant decrease. And the percentage of students who ever used marijuana in their life decreased to 26.8% in 2021. Again, looking at beliefs, percentage of students who think it's wrong or very wrong for someone their age to use marijuana is 61.8% in 2021, not different from 2019. But the percentage who think that people who use marijuana regularly have a moderate or great risk of harm did increase significantly to 58.6% in 2021. Going on to food insecurity, there's 1 question in the survey relating to this. The percentage of students who reported that they sometimes, most of the time, or always went hungry in the past month because of lack of food at home is pretty stable from 2019 to 2021, around 12%. And then finally, looking at housing, there are several questions related to housing in the survey. The best question is students who did not have a usual place to sleep during the past 30 days. Stayed similar from 2019 to 2021, 0.2% in 2021. And I just want to note that because it's such a small number, I changed the scale from 0 to 100% to just 0 to 10%. So to wrap up, what improved for Jefferson County high school students? Fewer students report drinking alcohol and using marijuana in the past month. Fewer students report ever using marijuana, and more students associate alcohol and marijuana use with health risks. What unfortunately got worse, more students report poor mental health that impacts their usual activities. And what didn't change? The percentage of students who considered or attempted suicide in the past year, the percentage of students who report food insecurity in the past month, and the percentage of students who report housing concerns in the past month. And just a reminder that the survey doesn't allow us to say why these things are improving, getting worse, or not changing, simply that they are. That was a very quick roundup of indicators related to our CHIP priority areas. What questions does the board have?
Questions, comments from the board? I really appreciate you doing this, and I asked Jody and I speak about every week, and ask specifically that we work on these issues because they are so incredibly important, especially right now. You hear so much about our youth and their mental health needs, and the lack of services and all of that put together. And I know this is a really good survey, so I really appreciate the work that you do on that. Are there questions, comments from the board? Harriet, you have your hand up.
So my question has to do with the housing issue. You said there were 3 questions related to that, and you reported on one, and it was a very, very short kind of recency time frame within, I don't remember, was the last month or the last 10 days or something like that. Were either of the other questions looking back over a longer period of time? Because my sense is that from everything else I've heard, housing issues in our community have gotten more problematic for people. And yet to have that not reflected at all in the one question, I'm wondering if either of the other ones might give a different kind of indication.
Yeah, that's a great question. So I want to clarify that the other questions that relate to housing would be among students who answered yes to this. Yes, I did not have a usual place to sleep in the past month. Then those students get questions that are like, did you sleep most of the time at a friend's house? Did you sleep most of the time in a hotel? So this is the question that kind of weeds out the who is a yes and who's a no. And to further get to your question, I don't think any of the indicators ask about a larger time frame than 30 days. There are other data sources that we can use to understand housing. I think the public school system itself collects more detailed information about students that are considering housing or have housing insecurity or instability. This is all self-report also, so students may not consider that they have housing stability, or the way this question is phrased, maybe they do have a usual place to sleep and it's a shelter. So
shelter of their car or something.
Exactly. So this question is not perfect. Really, none of the housing questions in the survey are perfect. There are more comprehensive data sources, and those also have limitations. I think previous versions of the agenda said that I would also present about housing data in Jefferson County, and we really have not great data sources to kind of capture the truth about housing insecurity and housing instability. And that's not unique to Jefferson County. It's very hard to capture that information.
Thanks.
Any other questions from other board members? Well, thank you, Paige.
Yeah, thank you all.
Appreciate your work on this.
Thank you.
And now we're going to hear from Michael Miller. I'm very happy to see you again, Michael Miller. He is going to give us a presentation on the Gateway to the Rockies Opioid Council, the Opioid Settlement Fund Distribution and Monitoring, which is currently going on. I believe you just had a meeting yesterday. Is that correct? Please fill us in.
Absolutely. Yeah, it was actually the past 2 days. I'm going to share my screen with y'all if that's okay. There we go. Sherry, you're the only one I can see. Can you see that okay? Thumbs up. Awesome. Cool. Thank you. So good evening, everybody. My name is Michael Miller. I'm going to start a timer here to make sure I don't go over. I'm the Opioid Initiatives Coordinator here at Jeffco Public Health. I use he, him pronouns. I'm also a person in recovery from an opioid use disorder and a survivor of overdose as well. So excited to be here talking with y'all tonight. I'm here this evening to chat with you about Gateway to the Rockies Opioid Council. It's our regional governance council responsible for the planning, funding, and monitoring of the use of opioid settlement funding for Clear Creek, Gilpin, and Jefferson counties. I'm honored to represent JCPH personally, the Substance Use Partnership, and other survivors as a member of the council. So I've really appreciated that opportunity. And to dive right in, just chatting real quick about how we got here. So between 2018 and 2020, we saw over a 54% increase in overdoses. We hear about it a lot in the media and in our communities, especially with the proliferation of fentanyl and other types of overdoses, including stimulants and alcohol. It just keeps growing, right? So in August 2021, the Attorney General's Office and the Colorado Department of Law announced that they'd reached settlement agreements with major opioid manufacturers and distributors. And this was in concert with attorney generals and law offices across the country in multiple states. And they also announced the framework in Colorado for the distribution of more than $520 million in those settlement dollars across the state for treatment, recovery, and prevention. Just recently, in January 2022, leadership in all three counties helped stand up our region's council, which we're technically Region 10, but I think we came up with a pretty cool name known as the Gateway to the Rockies Council. We identified our members and we started developing our plan to develop the plan. And I'll talk about that here in a second. So this is just a real quick map of how the state kind of broke up our regions. I think Gilpin, Clear Creek, and Jefferson are really kind of complementary, especially around substance use work. We're already pretty hard at work collaborating regionally on this issue, so it made a lot of sense. And then in terms of the settlement funds themselves, these come from a couple of different places, right? So a lot of it came from Johnson & Johnson and 3 other major distributors. 50 million came directly from Purdue Pharma, which was the manufacturer for OxyContin. It's a brand name of oxycodone that a lot of folks are familiar with, and the Sackler family directly, which were the primary principals in Purdue Pharma. We also had $25 million from Mallinckrodt and 10 million from McKinsey & Company. And then so this got broken up into a couple of different ways. The lion's share of the funding is going to each of those regions that you just saw on that map. Another large share is going to specifically local governments, and we'll talk about how that's broken down for our region here in a moment. And then 20% went to both the state and for infrastructure. So just a quick rundown of how that went. And so our funding for Region 10 kind of breaks down as you see here. So for Jefferson County, this is based on population. For Jefferson County, our regional shares, 24.5 million about, and you can kind of see our local government share, 8.1 for a total of 32.7. The total for Gilpin's 174,000, and the total for Clear Creek is 429,000. Just a quick caveat, there's a pretty good chance that there'll be additional funding that becomes available because we still have litigation ongoing and with both distributors and manufacturers. And a lot of the local government shares that you see here have the ability to be signed over to the region so that we can focus on more of a regional approach and regional initiatives to fund, as opposed to each individual municipality or local government attempting to make something work with not a whole lot of money. Especially, it's really important that we remember this is over 18 years. So like total local government share for Gilpin County, it'd be pretty difficult to do a lot with $43,000 over 18 years. So just an important thing to note there. And then in terms of allowable uses for the settlement funds, We have it broken down in a few different categories. The first one's treatment and recovery. I'm not going to run through all of these with y'all, but they include things like medication-assisted treatment, the prescription drug monitoring program. I think it's interesting that we can also use the funding for scholarships for certified addiction specialists like clinicians, therapists, but also peer support specialists, which are really, really important in the continuum of care here. And then we also have it focused on intervention, right? So a lot of this is, these are again, evidence-based treatment models. So things like ESPERT, screening, brief intervention, and referral to treatment. These are forms of programs that are really, really helpful in identifying substance use issues before they become really significant. So they're really helpful in school settings, hospital settings, criminal justice, kind of everywhere in between. And this also includes training and other prevention activities. And then there's a big criminal justice bucket. So this includes diversion, treatment, wraparound services for folks. And I think it's cool because it touches a couple of different areas, right? So clients who are already in probation or community supervision or are incarcerated, making sure that they have access to opioid use disorder treatment. And then, sorry about the typo there, co-occurring substance use disorder and other mental health issues. Also supports like pre-arrest diversion. We have a law enforcement assisted diversion pilot program with the Lakewood Police Department that Jefferson County is currently involved in. So really trying to ramp up efforts like that to try to divert people out of the criminal justice system. Also includes like opportunities to fund and help support our problem solving courts, like drug courts, mental health courts, our veterans treatment court, the FIT court, things like that. And then prevention and education. So really there could be a big bucket. So campaigns that implement evidence-based or evidence-informed prevention, education campaigns, training coalitions, and then other prevention stuff like prescribing practices, talking about opioid misuse, safe disposal of medications when they're no longer needed in the home, fentanyl awareness, school-based programs, and then again, community coalitions, faith, nonprofits. And then harm reduction, this one's really close to my heart, obviously. So being able to increase folks' access to naloxone, also known as Narcan. That's one form of it. They also have Cloxato and a few others. That's the overdose reversal drug that we distribute to participants in Points West. Syringe service programs like our SSP in Points West and our clinic at JCPH. Distributing fentanyl test strips so that people can test their drugs. And then access to testing and treatment for infectious disease like HIV and hepatitis. And so just to kind of talk about how we're structured, right? So we have the Region 10 Governance Council, which is the GROC, but we also have like a bigger version of that for the state, right? So the General Abatement Fund Council is responsible for oversight of each of the regional councils. They're also responsible for figuring out how to fund all the items in the infrastructure fund, and they're the folks who will ultimately approve our 2-year plan once we submit it. That includes 13 members appointed by Colorado Counties Inc. and the CML, and then 6 appointments by the Attorney General's office. And then for our local council, we're really responsible for developing iterations of our 2-year plans, convening local stakeholders, distributing and monitoring those funds. That's going to be a really important component of the council's job, is to monitor the effectiveness of the funding that's being distributed to our community partners. And then we try to decide who those regional contractors are. And so membership on the council itself is made up of 3 county commissioners, 1 from each county, a law enforcement representative from each county, court system rep, 3 public health representatives supposed to be from each county, and then 3 rotating city representatives who are supposed to rotate in year over year. And then next steps, sorry, I'm just blazing through this, trying to give you some of your time back here. So we've already completed the certification of our council membership, right? So we have all of our voting members pretty much established for the council to move forward with developing our plan. Another component of that is recruiting non-voting advisory members. So these are other people from the community with lived experience, professional experience, who can help advise the stakeholders or the council members on how to proceed next. And so that's a process we're currently involved in. We have several people on that roster, but we're trying to grow it a little bit more as well. If anybody is interested in participating in that capacity with us in the council, please reach out and I would be happy to get you connected. I will put my email in the chat here as soon as I wrap up, if I'm allowed to put stuff in the chat. And then so our other responsibilities where we've completed our bylaws and the governing agreements. I think there's still a few IGAs out there around municipalities contributing their local share to the larger regional effort. I think those still, a few of those might still be in the wind, but we have the majority of that completed. And then we've appointed our fiscal agent for the region, which is going to be Jeffco. Clear Creek and Gilpin were really gracious about that. And then we're currently in the process of developing that 2-year plan. And that's a big process, right? So currently we're planning over the next month to have 3 half-day meetings to really finalize what our plan looks like, with the goal of submitting that first plan at the end of next month at the latest. And so that's going to be identifying partnerships with other folks in the region, really leveraging the expertise and breadth of knowledge that's possessed in our stakeholders across the entire region. We have really, really solid representatives within that advisory council to help kind of inform really solid choices there. We're also encouraging we're encouraged to find what they're calling braided funding streams. So that's just kind of complementary funding, things like overdose data to action or the harm reduction grant programs to help supplement what our activity is going to look like, including ARPA funding. And then submitting that 2-year plan. And then in terms of a timeline, we're expecting settlement fund distributions to begin in Q4 of this year. And then that will continue over the course of 18 years. And in March, we will be, we'll have the opportunity to submit an amended plan if necessary. Let's see what I'm missing here. And a big component of that has been selecting a contractor to help facilitate the council itself. I was working very, very closely with Commissioner Marlin and Commissioner Dahlkemper to help facilitate our council up until the point where we got a contractor selected. We've completed that process, or we're working with an organization called the Stedman Group, which we're really familiar with in Jeffco. And they've really knocked it out of the park. We also recently just completed our stakeholder kind of kickoff event for the Gateway to the Rockies Opioid Council last month, where we hosted stakeholders from across the region to talk about what priorities they might have, ideas about what's working well, what we're not seeing in the community, but what we'd like to see in the community, and getting the perspective from people with lived experience. Like, it was a really solid opportunity to really kick off our work together as a council. And that's it. I don't think I missed anything, but if anybody has any questions, please feel free to ask that.
Michael, I do have a question. When you talk about treatment back at towards the beginning of your slides, you know, one of the biggest issues that we have is when people say, okay, I do need help, you know, then they're left to sit there for 2 days, a week, 2 weeks, and you've lost them. They're gone. They're not gonna just not go use, because you said that you would work on, not you, but you know, the system. How does this group maybe want to address that issue? Because that's one of the biggest issues out there, is people that actually do want help can't find it.
That's a great question, and a problem that I think we've been trying to solve for a long time. I think one of the most important things that the council is going to be focusing on is data, right? So identifying measures and indicators so that we can have like a pretty clear picture of how big of a problem that is and for whom that's a problem. So things like, I think in our community health needs assessment, we ask folks have you thought that you needed treatment but weren't able to access it, right? So measures like that will be really, really important. And the other the initiatives, right? So some of the allowable uses of that funding for treatment is really focused on warm handoff, right? So if somebody comes and sees us and points west tomorrow, we're able to get on the phone with somebody from like Jefferson Center, for example, or a primary care provider who does medication assisted treatment, and be able to say like, okay, great, this is the process that you're going to need to follow. This is where you need to go this afternoon to be able to start accessing that care that you're asking for. We're pretty far way out from that, but we have really solid models to follow for that we can kind of lean on and use as case studies and then just expand on it. Does that answer your question?
Well, yes, it did. And included in that, I hope that you are including, because a huge percentage of it is Medicaid, because not a whole lot of providers take Medicaid, or they take as little as they have to because they don't get paid as much, which is understandable. But I mean, you're going to find the biggest populations that are on Medicaid that are the ones needing help.
Totally agree.
I don't have to
totally
tell you
agree. And that's Medicaid is difficult to administer from kind of an administration angle for treatment providers, right? And especially for private treatment providers, folks that aren't like Jefferson Center, for example. I think that there's really great provider education opportunities to help give them the tools to begin the process of being able to offer treatment to the Medicaid population, or helping the folks that are uninsured that they're seeing get on Medicaid so they can be reimbursed for it and not like billing an individual, for example.
Kimberly, you have your hand up.
Thank you. Can you hear me okay?
Yes.
Thanks.
Oh, we lost you then.
I keep hitting the wrong button.
Oh, there
First
you are.
of all, Michael, I want to thank you for all of the work that you and your colleagues are doing for this critically important issue that faces everybody in Colorado. Looking at what's ahead for the next 2 years is very exciting, if I can use that word, as we try and reach more and more people. That being said, of the $25 million grant that will come directly to Jefferson County, if I understood that slide correctly, is it possible to get a breakdown of how that money will be spent in Jefferson County, to kind of coincide with the outlines and the activities that you've shared with the board? I think it's really important, especially as we're looking at funding cuts, across the state, that we are transparent and we can help the community to understand how you and your teams are utilizing that money. Thanks.
Thank you. And that's a great question. I think that it's top of mind for the entire council to make sure that we're being exceptionally transparent about where money's going, how that money is going to be accountable, and geographically kind of where it's happening, right? So like somebody in Green Mountain might have a little bit more interest about what's happening in Green Mountain than like Arvada, for example, right? And so as we develop that 2-year plan and really kind of break down which initiatives are going to get what amount of funding, where that work is going to happen geographically, that's going to go on the Gateway to the Rockies Opioid Council's website, which is it's part of the county's website currently under commissions and boards, I believe. But that's going to be readily accessible for both stakeholders and leadership, like we have here with the Board of Health, but also community members as well.
Awesome. Thanks, Michael. I really appreciate that.
Further questions for Michael Miller? I'm just hoping that, what is the timeline for the money that actually, I missed that part, and I know it, but I can't remember that it's actually going to hit, that we're going to get it?
So we're expecting the first payments to hit the fiscal sponsor, which is Jeffco,
Right.
in the 4th quarter of this year.
Of this year, right?
Yes.
And so will we be able to start some of this stuff like fairly immediately? I hate for us to wait to see how many more people die from these fentanyl overdoses, that we get started right away.
That's a great question. I sincerely hope that we're able to get started right away, right? So that by then that statewide abatement council has had the opportunity to approve our region's 2-year plan by the time that those payments start coming in. But I think as soon as our plan is approved, and we are going to have that submitted by the end of September, which is the deadline for that. I think that we can start work pretty much immediately. Like the contracting kind of administrative processes associated with getting that funding to the appropriate contractor might be a little bit difficult. It might be a little bit new, but I think everybody's really committed to making sure that there's not much waiting happening.
Okay. Harriet, you have a question, comment?
Another question, it's telling me I'm muted, but I think I'm unmuted. Can you hear me?
We can hear you.
Okay, good. So, you know, at first you go $24.5 million, woo-hoo, you know, and then he said over 18 years, and it's kind of like, well, that's just not very much money for the whole county. And does it come in 1/18 at a time, or is there some ability for it to come in based on the planning if you need like startup funds to get a new program going or something like that, you know, that brings it in on at a different rate? How much control do you have over that?
So I'm not 100% confident in my response to that question, but I will find it. What my understanding is currently that there will be a bit of front loading in those first few payments in order to help with the planning and administration of a lot of this stuff. So yes, I will track down the information for you on that and get back to the BOH with that, because I think that's a really excellent question.
Thanks. And thanks for your work.
Thank you.
Thank you, Harriet. Are there any further questions for Michael? Well, I don't see any. Michael, thank you so much for the work that you do on this. I'm always thrilled to really watch your progress and how you work on in the community. Oh, nope, she's clapping for you. She's not raising her hand.
Well, thank you all so much. I appreciate the opportunity to chat with you.
Thank you very, very much. Okay. Let's move right on to old business. And we need to have a brief update from Jody on the FAB update, the FAB stuff. Jody, are you there?
Sorry about that. When I shared my screen, it would not let me unmute. So let me try this again. Okay, thank you again. And oh, didn't go into presentation. There we go. So thank you again. Good evening. I'm just going to do a couple-minute update on our accreditation process. Part of the process says that we need to come do these updates for you. So I believe it's been 3 months since I last spoke to you about this, and we'll be doing quarterly updates as we move forward. The purpose the last time was to just let you know that we were moving in this direction and kind of outline the process for you a little bit. I'm going to go over a couple of those things again, just as some reminders, but really the highlight for tonight is really to go over the accreditation measures that pertain to the Board of Health, and I'll jump right into it. So really these, as a reminder, are all wrapped around the 10 essential public health services. That's how the domains and standards are developed, is the 10 essential public health services. This reaccreditation process is a little different than the initial accreditation process. The accreditation process was a lot of documentation and felt like a massive checklist that we had to go through and provide documentation and meeting minutes and meeting agendas and policies and procedures and all different kinds of things. This is really focused on how we're implementing those things that we did the last time around. It's more about the narrative than a checklist, which feels a lot more comfortable and meaningful to me. So more of that continuous quality improvement versus kind of the checklist. So we're accredited for 5 years. We got accredited in 2019. And so to remain accredited, we need to go through this process, of course. And the application needs to be submitted by early 2024. And so really this is about doing the right things for the right reasons. Honestly, we talked a lot about this. I think when we presented to you the last couple of times, we really want to make sure that we're kind of driving FAB rather than FAB driving us. We don't want to do things just for the sake of checking a box for reaccreditation. We really want to integrate these into how we're doing things as an organization. When COVID hit us, we had just become accredited, and we actually stopped doing some of these things just because they were still kind of new and things that we had built solely for the purpose of accreditation. But now we're really hoping to build some processes and say, what are we already doing? What do we do well? And how can we wrap that into the accreditation standards versus saying, let's build something or create something new because a standard or measure requires it. So it really helps us focus our work, create efficiencies, and again, focus on quality improvement. We're working under new standards this time around. The last time was version 1.5. And again, it feels different this time. I was really worried about it coming out and us having to go through a process with new standards and having to do some different things. But again, it's very focused on tell us what you've been doing, tell us how you're doing it, versus just the checklist and providing documentation. So it definitely felt a lot more comfortable to me, and a lot more, I guess, meaningful and valuable, I think is the word I'm looking for. It felt like more valuable to me that we could, again, use this to support what we do versus just kind of going through a very formal process. So we're starting to practice the standards this year and next year. That will be a focus for us. And then by next year, hopefully we're kind of really in a groove with practicing these standards and can really focus on the application process. So taking all these things that we've built back up that we're doing for the standards and measures and putting those into the application, which is, it's a pretty robust process. It takes quite a bit of time to develop that application. So that's going to be next year. So we're prepared for the early 2024 submission. What does this mean for all of you? We have 5 measures that, and you're not in charge of this. I think that's one thing I should make clear. You're not required to facilitate these. This is something that several folks inside the organization. So we have people assigned to all the different measures. And I can't recall exactly who's assigned to these, but these are things where we're going to be engaging you through either the board meeting or maybe 1 or 2 outside of the board meeting. We need to bring to you data for decision-making. And have you kind of look at that and say, you know, we want to go this direction, or we want to go that direction. So that could be involving you in the community health assessment process, or maybe the community health improvement planning process. Once we're done with the CHA, we have to move into a health improvement plan from that data. So could be engaging you around that. We will ask you to adopt a strategic plan, which it's really our strategic projects list that we have done that we're starting implementation on. So we need to come to you and formally request your adoption of that. And then monitoring that, of course, too, we have to come to you and kind of similar to what I'm doing today, provide updates on that strategic plan and just kind of get your feedback on where we're going on it. What you've done recently with our budget and what you do at every one of these meetings is look at our finances and help us seek resources. And that one's probably going to become really important here going into 2023 and 2024 as we see the county's resources shrink and see our resources shrink. That we'll have to more actively engage you all in that process. And then communication between you all and us, which we do pretty regularly. And again, last time they had very specific requirements about what that needed to look like and what steps we had to take for that to happen. This time it's not as formal or structured. So I think we meet a lot of this already, but it's just a matter of making sure that we're able to show them that we communicate routinely with our board. So those are the 5 pieces that you will be seeing more about as we move forward. If you want to learn more about this amazing process and the requirements, feel free to go to the FAB's website, and we have the standards linked here in this presentation. But if you need a copy of those in another format, let us know. It's a pretty long document. I still haven't read the entire thing word for word. I've read most of it though. I would not recommend, I don't think you all need to do that, but if it's something that you really want to learn more about, we can definitely get you connected to that document. So action plans have been created, which is really exciting to me. The way that we're managing this process is very much like projects. Each one of these measures has been broken down as a project. We identified leads, and each lead had to say, okay, through the duration of 2022 going into 2023, what do we need to do to meet this measure, to meet these standards? And we developed these plans and submitted those here just in the last couple of weeks. And then we have to implement the plans and really start to say, okay, if we needed a plan for X, we start to build the plan. And then, of course, continued updates on all those to our senior leadership team and to our leadership in the organization and staff around what we're doing with those. So we will continue to provide updates to you all with a lot of this. I look forward to those. And so we'll be coming back in October for the update, but you're probably going to hear more about this as we engage you in some of those measures in the coming weeks. If you have questions, comments, or anything like that, I'd be happy to try to answer some. I think Kelly Keenan's online too as our accreditation coordinator to help answer questions, or you can feel free to email either one of us as well. Thank you.
Thank you, Jody. And thank you, Kelly. Are there questions from board members? Do I see any hands going up? No. Well, thank you for doing that. It is exciting to see the pieces when they start coming together, isn't it? Now we're going to go to the senior leadership team updates, and Dr. Rowan, welcome. Are you with us still, Dr. Rowan?
I am. Can you hear me?
We can.
Okay, I'm at a computer that apparently the camera doesn't work on, which I'm very sorry about that. So you can't see me, but I can see you. I'm in clinic today. I see patients on Tuesday afternoons, but clinic is over, so it's perfect timing. I do have a few updates about monkeypox to share, and then I'm happy to answer questions about monkeypox because this is a very important topic right now. So just to give you a few slides to kind of bring everyone up to speed about the current situation. So monkeypox is a pox virus, and it's in the same family as you can see here as variola virus, which causes smallpox. Pretty much most of our knowledge about vaccines and treatment comes from smallpox. They're very closely related, and our testing is for orthopox virus, which is the family that monkeypox virus is in. You can see some of the characteristic rashes here. The one on the hand is very uncharacteristic, but these pox sores can get super infected, and that's what's going on there. So the typical situation with monkeypox is that people will have incubation periods of 7 to 14 days, meaning it takes about 7 to 14 days from exposure to development of illness. It can be as long as 3 weeks, though. A lot of people traditionally would have a prodrome, meaning symptoms before the rash, which could be fever, weakness, headache, lymphadenopathy, sore throat. In particular, lymphadenopathy with fever 1 to 2 days before the rash has been well described. Then the rash, and then resolution of the rash. And the sores are actually contagious until the scab has fallen off and a fresh layer of skin has formed. So the duration of infectivity for this virus is pretty long, which is pretty challenging in terms of when people have to isolate at home while they wait for this whole process to happen. And here's the general progression of the sores. That's the traditional way. And here's, again, some more of the pox sores, which you can appreciate, hopefully, that these are pretty variable and can look like a lot of other things. They can look like acne, pox sores, herpes sores, blisters. They're not super specific. Some of the sores are more characteristic than others. The new monkeypox that we're seeing with the current outbreak is a little different than what's traditionally been reported, in that many cases are presenting with the rash first. Many cases don't have the classical clinical picture of the fever and sore throat. A lot of people do have swollen lymph nodes. Sometimes people are presenting with only a few lesions or even one lesion, and they are sometimes beginning in the genital or perianal areas, and they're not necessarily spreading to the face or around the body the way that monkeypox has previously been described. We also traditionally thought of monkeypox as having lesions that were all at the same stage, but what's happening now is that they're appearing at different stages, and new lesions are popping up as old ones are resolving. We are definitely seeing a lot of people presenting with rectal pain, which is called proctitis, and a lot of swollen lymph nodes as well. The modes of transmission during sexual contact of monkeypox are somewhat unknown, but basically this is a virus that's transmitted through close skin-to-skin contact with an open sore. It can be transmitted through objects that have been in contact with the open sores, or through respiratory droplets, though that requires close contact for a longer period of time. This is not nearly as contagious through respiratory routes as something like COVID-19 or the flu. And it's unclear what role semen and vaginal fluids play in transmission. So there are medical countermeasures stockpiled for orthopox viruses, and as I mentioned before, this comes from our experience with smallpox. There are vaccines and there are treatments. Of the vaccines, there are two that are FDA approved for smallpox. They are available under an emergency use authorization from the FDA for monkeypox. And the one that we're using is the Jynneos vaccine. This is a replication deficient viral vector. There is no risk of causing an infection with this vaccine because it's not a live virus. We're seeing very few serious adverse events from this vaccine. And it's given subcutaneously in 2 doses, traditionally 28 days apart. There's an effort now to switch to intradermal injections because they don't require as much volume, so we can stretch our limited supply of vaccines. And the current strategy to stretch the limited supply of vaccines is to only give 1 dose. So we're giving partial protection rather than the full 2 doses so that more people can get at least some immunity. Immunocompromised persons are eligible for that second dose 28 days after the first one. We also have a treatment available, and this is available through investigational new drug protocol. So it's a fairly labor-intensive process to get access to this treatment, but it's an antiviral medication that's approved by the FDA, again, for the treatment of smallpox. And right now, we're using it for people who have more severe monkeypox symptoms. So people who have severe pain, extensive lesions, eye involvement, who may have superinfections of their lesions, may need to be hospitalized, or may have even more serious complications. So many people are not needing treatment, but it is available for people who are sicker with smallpox. And it's also available for people who are at risk of severe disease, so people who are immunocompromised in children, or people who have severe eczema would be good candidates for tecovirimat, also called TPOXX. As you know, hopefully this outbreak started in May and rapidly spread around the world. And so this is a graph that only goes to June, but you can see the dramatic rate of increase of countries affected. Right now, globally, there are 38,000 cases reported, and the vast majority are in countries that have never seen smallpox before, or countries that have only seen imported cases of smallpox. In the U.S., there are 12,689 cases reported, and in Colorado, there are 155 cases reported at this time. And the state health department is reporting that 4,082 people in Colorado have received the monkeypox vaccine. Jefferson County, we have 13 cases of smallpox occurring among Jefferson County residents to date. 9 people have been tested through our health department, through our sexual health clinic, and 5 have tested positive so far. The health department has given about 150 vaccines out, and I'll just give some congratulations to the immunization and sexual health clinics because they were 2 of the first clinics in the state to offer these services. Testing is available additionally at some of the urgent cares, Insura, various primary care departments, primary care networks in Jefferson and in Denver County. The goal is to make testing even more widely available so that all medical facilities will offer this really important test to their patients. And vaccines are currently available through the JCPH immunization clinic per the CDPHE guidelines, and there are additional sites throughout the state for vaccines. I think that's the last slide I have. So with that, let me know if you all have any questions.
Kimberly, I know that you have to sign off here shortly and you have a question. Do you want to go ahead?
This is just a clarification. Dr. Rowan, thank you for that great update. I think it's really important that the citizens of Jefferson County have an opportunity to expand their understanding and to have assurances that the state and Jeffco, Jefferson County Public Health, is monitoring this. On your last slide, the first bullet point, I believe you stated there were 13 cases of smallpox. Did I mishear you say that? Should that be 13 cases of monkeypox?
I don't remember what I said, but yes, monkeypox. Yeah,
Thank
not
you.
smallpox. If I said that, I apologize.
Yeah. Nope, that's
we have,
okay.
Yep. So of
Yeah.
of the 155 cases in the state of Colorado, 13 are among Jefferson County residents.
And are we keeping statistics or data on kids versus adults?
Yes, definitely. So right now, I believe that nationally there are about 5 children who have tested positive for monkeypox. So it's been rare among children, but there is certainly a concern that that may change.
Perfect. Thank you for your help, and thanks again for tonight.
Any other questions for Dr. Rowan from the board members? I don't see any. Thank you for coming and sharing with us, Dr. Rowan. We appreciate your time.
Yep, my pleasure. Thanks for making the time.
Okay, moving on. Oh, look, we have Jody Irwin. Do you have new things to bring to us in your comments?
In the last 20 minutes,
calling on you today.
I have a huge list that's built up in the last 20 minutes. Actually, for the sake of time, I will turn it over to the other directors and basically just leave it out. If any of the board members have any questions for me on anything, I'm happy to try to answer it. Thank you.
Okay, thank you. Joe Valdepour, do you have anything?
Yeah, I have a quick update, and I wanted to expand on some of the comments that were made during the financial report. And I originally had debated on whether or not I was going to discuss some of these items, as I don't have many details to share at this time. However, as was hinted during the financial report, there are some items that are being discussed at this time at the county level that could potentially provide some additional ARPA dollars for the department. And when Jody presented the budget, we had more of a grimmer outlook, I suppose, with next year and potentially the years that follow with our budget. However, there are still ongoing conversations that will hopefully fill some of that gap in funding. So I hope for the staff that are on the call for the Board of Health, just know that there are continuing conversations around funding shortfalls that will hopefully provide a little bit more financial security for the department. At this point, I don't have, like I said, extensive details to share, but just wanted to make that comment that there could potentially be some more funding available for this department. And I hope to have those details to share at the next meeting. Thank you, everyone.
Thank you, Joe. Jim Rada, I did see you on there. There you are.
Yes, good evening. Just one update this evening. Back in June, you may recall, I did report out to the board regarding the ethylene oxide emissions issue related to the Terumo BCT facility here in Lakewood. At that point in time, the EPA and CDPHE were still planning some public announcements and some public events. EPA held its national public webinar relative to the entire country, or all the facilities that they're working on some new regulations to deal with ETO emissions, or ethylene oxide emissions. And then, and I'll make sure that you get the links to the presentation. So if you have the inclination, you can go ahead and listen to the information that was shared via that EPA webinar. EPA Region 8 and EPA National Headquarters is planning a local community meeting for the Lakewood community, primarily those communities surrounding this facility. It's been scheduled for September 22nd at 6:30 from 6:30 to 8 p.m. It'll be a virtual webinar or virtual community meeting. And I will also make sure you have the link to sign up for that also. At this point, there is not much else to share other than that they are seeking they're seeking first to inform the community of the issues related to medical sterilization facilities that utilize ethylene oxide as the sterilant. And then they will be also seeking input from the various communities around the country regarding a proposed set of regulation changes that will be presented. They've promised somewhere near the end of 2022. And then there'll be a rulemaking process that will proceed through a good part of 2023. So we will have our opportunity to weigh in. The community members here in Lakewood surrounding that facility will have the opportunity to weigh in also. I've made the county commissioners aware of what's going on. I believe some of them may have attended the national webinar. If not, I know they were informed with a summary of that webinar. And then the city officials are also very aware of what's going on with this facility and this initiative through EPA. So that's all I have to report out today. Again, the community meeting will be September 22nd, 6:30 to 8 p.m. and it will be a virtual community meeting.
Thank you, Jim. Well,
Kimberly has a question. Kimberly?
Oh, Kimberly. No, she's clapping for you.
Oh, clapping. Okay.
Yeah, she's not. She's way to go, Jim. Okay, Carrie, I see you're on with Family Services. Give us your update.
Yes, nice to be here tonight. I wanted to inform you that at the request of Colorado WIC, they have requested Jefferson County WIC to provide additional support. This is connected to the dissolution of Tri-County Health Department, which has historically been a really large health department that's been able to provide support to smaller counties in Colorado for the WIC program. But as they evolve into their smaller health departments, Jefferson County has been called upon to support some of those smaller counties. So Tatiana Dykes, our excellent WIC director, is taking on those responsibilities. And that comes with accompanying funding from the state. And that will start October 1st of 2022 and will go through through September 30th of 2023. And they're well positioned to provide this support. So they do have an additional registered dietitian who's helping specifically with this work. But just wanted to let you know that we are stepping into that role to support smaller counties here in Colorado. I also wanted to update you with our nurse home visiting programs that we are returning to the in-person visits after, a long COVID run where we were providing primarily telehealth. We are really making that move to get back into the homes. And anecdotally, I'm hearing from the nurses how valuable that is. And some of the nurses who were first hired during COVID and maybe were trained and never did in-person visits are really voicing their enthusiasm for this and how being able to provide that hands-on support for things like breastfeeding, postpartum has really, I think, opened their eyes to all of the value of those in-person home visitation from our nurse visitation programs, things like the Nurse Family Partnership Program, but also our Healthy Start at Home and our NICU to Home program for our most vulnerable infants who are coming out of the NICU and going home. So just wanted to give a shout out to those nurses and supervisors who are supporting those programs. And then I wanted to give a quick update, or maybe not quite so quick, but just on the gun safe project that Sophie West had initiated using ARPA funds. She is our child fatality review and injury and violence prevention. That proposal was approved and in partnership with Sam Taylor from Jefferson Center and the team at Bristol Cone Shooting Training and Retail Center in Lakewood. They were able to purchase just under 300 biometric single gun safes, and Sam Taylor and Sophie West worked with Jefferson Center, School of Mines, and Red Rock Community Colleges to create that gun safe distribution plan. Red Rocks and Mines both decided to distribute gun safes to students through their student wellness and counseling centers, campus law enforcement, public safety, and to their veterans programs on campus. And Jefferson Center is distributing to clients in need of a gun safe. They also, in this program, decided to pilot the use of asking recipients to answer 2 survey questions. It's a confidential survey. It's completely voluntary, but they're encouraged to fill it out to provide some data on this project. And the questions are regarding how was your firearm previously stored? And if you did not previously store your firearm in a gun safe, gun lockbox, gun case, or gun lock, why not? And were there barriers to securely storing your firearm? And this wasn't required by the ARPA funding, but they created this in hopes of demonstrating how valuable the resources can be to the firearm enthusiast community members, keeping firearms in their homes. And we also hope that it'll provide us valuable information about their barriers to safe firearm storage. And lastly, this pilot program will really give us insight into the power of partnership across varied systems, sectors, beliefs, and values to prevent suicide and firearm violence in our community. So kudos to Sophie West and Sam Taylor on that project. In addition, funding was also secured to purchase 400 lockable medication bags that are being distributed to youth and families in need of safe storage. And these will be distributed through Jeffco schools beginning in the fall of 2022. So everybody's involved is really excited about this work and the ability to use ARPA funding in this way. So just wanted to update you on that project and how they're trying to evaluate it.
Well, thank you, Carrie. Doing a lot of work over there. Gwen Rodman with the clinic services. Are you on, Gwen?
I am. I'm here. I
There she is.
apologize. My video is not working. Oh, maybe it is now. There we go.
And do you have an update to give us?
I just have a quick update. I want to start off by congratulating our August Employee of the Month, Lindsay Milner, and I think she is still on the call right now. She's our sexual health public health nurse lead in clinic, and I just wanted to read a little bit from her congratulations letter. Lindsay is a foundational rock for this clinic. She rises to every challenge and does so with a positive attitude. In the past few months, she has completed multiple vital tasks of open positions. She has reorganized the lab and pharmacy and has been working on updating manuals and process to ensure compliance and safe patient care. She's a member of the team that all colleagues feel comfortable asking for help. Lindsay's enthusiasm and dedication are without exception. Her colleagues are uplifted by her public health spirit and collaborative approach. Every staff member in the clinic is comfortable approaching her with questions or feedback. She is an empathetic listener. She is reliable in her follow-up. I just want to congratulate Lindsay and thank her for all that she does every day. She's an incredible asset to the team.
Thank you so much. I'm so sorry I couldn't unmute and I couldn't show my computer. But I just wanted to say thank you. And one thing I just wanted to give a quick shout out to is I wanted to say I'm so grateful for all of our programs, but also our Bridge program, which provides medication for people with opioid use disorder that Michael was talking about. We do accept Medicaid patients and we do provide that quick bridge to help get patients to long-term care. So I just wanted to provide a quick plug for that since that was a topic during our meeting today as well.
Thank you, Lindsay, and congratulations. And maybe that looks like you'll be at our luncheon, which is next Tuesday, the 23rd, for our employees of the month. I look forward to seeing you.
Thank you so very much.
Thank you. Okay, and was that it, Gwen? I
Yes,
don't mean
that
to
was all.
cut
Thank you.
off.
No,
Okay. And Christine Billings, are you still with us? There she is.
I am still with you. I just have a couple additional updates. We continue, as Dr. Rowan gave her update, to respond to the monkeypox epidemic. We have not activated the public health emergency operations plan, but we are operating under the incident command system because we have so many various programs across JCPH involved in the response. So we are meeting weekly as an incident command system to provide updates and coordination to the response from a JCPH perspective. We are also closely monitoring information coming out of the state of New York regarding polio and the one confirmed case of paralytic polio, as well as the positive surveillance hits that they've had on their wastewater surveillance. So we are continuing to watch that and closely following what the state of Colorado might do with wastewater surveillance efforts for polio as well. That's it. That's all I have.
Well, you haven't been busy enough, Christine, I'm telling you.
Just put all the emergencies on. We're
Thank
good.
you. Thank you. Okay, and that takes us to staff comments. Are there any staff comments that anyone would like to share? Before we go to the Board of Health? Staff, oh, Carrie, you have your hand up.
Oh, I just wanted to also mention, because I forgot to earlier, that I just wanted to give some recognition to Kelly Cast, who is the manager of the Healthy Jeffco Alliance, but she also sits within the Family Services Division of Jefferson County Public Health. And she has offered and is available and with planning with Jody and myself is able to continue to support some of the JCPH CTC staff who are working at the health department and continuing their work. So just to know that there is support here at the health department from Kelly Cast supporting those staff members. I just wanted to give her some recognition for volunteering to step into that role right now.
Thank you, Carrie. That was nice. Any other hands going up? I don't see any. Okay, let's move to Board of Health comments from our board members. Who wants to go first? Harriet Hall will go first.
I want to thank Jody for filling us in on the situation with CTC. I have to say, when I started hearing about that just in the last couple of days, I was totally befuddled and not sure, whether to like call Jody up right away and say, what's going on? So I really think that it was helpful, not just for us as board members, but for everyone in the meeting to hear the context that you put into things. So thank you for that. And I've known about CTC for years and years and years and really valued the work, still value the work that they do, and hope that we can move all of this to someplace where we've gotten past hard feelings that's clearly have been generated in the last couple of weeks, and back to collaboration, because I think that Jeffco does collaboration well. We've been known for our collaboration, and I hope we can continue to do collaboration well as well. So, so anyhow, so thank you for filling me in, filling us in on that, and I look forward to hearing more, and I look forward to things moving in a positive direction. I also want to thank Joe for giving us a few encouraging words about the budget. And I want to thank everybody, because there was tons of really good information in this board meeting this month. And so for all of you who shared information, why thank you. I'm pleased to be a member of the Board of Health. So.
You have to unmute. Thank you, Harriet. Other board members, I know Kimberly had to sign off. Lane, do you have a comment?
Yeah, and it'll be much shorter because Harriet did a fantastic job of covering a lot of things I wanted to say. So I do really want to put a shout out to all the staff that shared information with us. Fantastic work. It's just great to see the breadth of work happening in our community. I do appreciate the CTC updates too. That has been challenging to the Board of Health has kind of been put in a role that it's us that is stymied and us that's making a decision. And I appreciate Jody really sharing. We are not the funders. The state, issued a grant to Jefferson County Public Health, and as the financial steward of the work. So the Board of Health is not the person who makes the decision on where that funding goes. So we don't have that ability to make that decision. I think the board has shared, and probably still do, I'll at least speak for myself, we want to see that group succeed. And I know Jody echoed that's his goal too. And I think in the last meeting I just shared, make sure there's no unintended consequences. You've kind of made sure all those pieces, and it sounds like there was one that was not uncovered previously, that the state was not willing to, while some people who were talked to may have said, do this, it wasn't the people who make the final decision. So I hope that can be resolved quickly, because that has been a fantastic effort. I am sad to see Pamela go. I'm sorry that because of, these things that have come up, felt that was, the fault of Jefferson County Public Health, and I don't think it is. So again, I appreciate staff trying to work on this. Just from my perspective, if the group still wants Jefferson County out of it and wants to roll the dice on losing it, I don't know that that's the smartest thing for our community, but I wouldn't stand in between them, as my personal opinion. If they really think they can get this money without Jefferson County Public Health, I support them trying to do it. I just am cautious, given that we've already heard that the state has not necessarily agreed to that. So that to me is a big rolling the dice in our community to lose that money completely. So that I think that it is wise to do the due diligence and make sure that has been figured out. Other than that, no, I appreciate all the work that staff are doing. Just as we're done with COVID, there's more communicable diseases just facing our community, hopefully never to the scale of COVID, but just a need for the constant work of these overtaxed public health folks.
Thank you, Lane. And I will just say thank you to everyone as well, and to remind the board members, if there's topics and issues and stuff that you want to come before the board, to please let me know so we can get them on the agenda. This has been something that's been on my radar now for the past 2 to 3 months, of really wanting to, talk about the substance use disorders and more mental health stuff, because I really don't think that the public even understands everything that this department does around those issues, around the mental health, and the partners that we have, and the great work that we do with those partners. So thank you to all of the staff that work so diligently on that. And thank you to Michael Miller, who very, very well put that together very well. So I appreciate it. And thank you, Jody, for getting it onto the agenda for us. With that, are there any other comments from the board members? I do not see any. So with that, we will adjourn at 6:05. Enjoy the rest of your evening. It's a nice, cool evening out there.
Thank you, everyone. Have a good evening.
Thank you.